Okay, so welcome everyone to the second portion, the Q&A portion of our annual symposium for the Biomedical Ethics Unit. Today, our symposium is called the Psychedelic Resurgence in Psychiatry, Ethics, Epistemology, and Enthusiasm. So I'm Phoebe Friesen. I'm a faculty member here in the Biomedical Ethics Unit. I'm also a Department of the Social Studies of Medicine, one of the co-sponsors of this event. I'm really excited to have everyone here today. I'm really excited at how many people have already watched the video, over 300 at this point. And I'm really looking forward to taking part in this conversation today. So I hope you all enjoyed watching the video ahead of time on YouTube, and just a warning that this is going to be recorded. So I just want to start with a brief land acknowledgement. Well, I know we're probably distributed across the world right now. I know our speakers certainly are. I'm currently in Montreal, also known as Jojage in the language of the Gunion-Gahaga, whose unceded territory McGill University is situated on. If you want to check out whose lands you might be situated on, you can look at native-land.ca, which is a great resource. Given that we're exploring topics related to research ethics and plant medicines today, two topics that Indigenous people, either here or elsewhere, have long held and continue to hold a tremendous amount of knowledge around, I think it's worth reflecting on what we might learn from them and how we can engage in decolonial ways of learning and producing knowledge in doing so. So just a brief word about what to expect today in this hour and a half we have together. So in a minute, I'm going to pass it over to the director of the Biomedical Ethics Institute to welcome you all. Then I'm going to introduce each of our speakers, and they're each going to give you sort of a brief summary of their talk or some key takeaways or updates, just to sort of remind you of who they are, their faces, the themes that they spoke about. Then I'll ask the panel a couple of questions, and then I'm going to offer it over to them to ask any questions of each other they might have. And then after that, I'm going to turn it over to the audience. So it'll be up to you to ask questions. So the way that it works is you can write to me in the chat. So the easiest is if you have a question, you can just write to the host, that's me, and say, I have a question, or just the word question. And I'll just keep a tally of the list of people who have questions to ask. That's if you want to ask your question, up front with your video and audio on. If you'd rather not be part of the recording or, speak or be on video right now, you can just write your question in the chat, send it to me, and I'll read it out to the panelists. So it's up to you. In the meantime, if you can keep your video off and your audio off, just so we can have a smooth recording for later, that would be ideal. And then you can turn your mic and your video on when you're asking a question. So at this point, I'm going to turn it over to Jonathan Kimmelman to welcome you.
Hi, everyone. Welcome. I'm Jonathan Kimmelman. I'm the director of the Biomedical Ethics Unit. We are a very small group of scholars here at McGill that study various ethical dimensions of medicine. We're small, but we're growing. And in fact, Dr. Friesen here is our most recent hire. And in coming years, we expect to become a department that's going to be much, much larger. And so look for more activities and seminars from the Biomedical Ethics Unit in the near future. Every year we organize a symposium on some aspect of medicine and ethics. This year's symposium is a topic that is just shot through with ethics content. As I listened to the speakers, there were so many different issues I found myself wondering about, ethical standards historically in this realm of research as I listened to Andrea Tone and Erica Dick speak. I also wondered about some of the particular ethical challenges in conducting clinical trials today in this area. I found myself wondering a lot about the quality of the evidence, historic evidence, but also the quality of the clinical trials that are being conducted today. And I also found myself wondering a lot about this demarcation challenge between this kind of stigma, kind of recreational drug use versus medical application of these approaches and how that kind of moral boundary is negotiated as we move forward with developing various medical applications. In any event, I'm looking forward to these discussions. I want to thank the numerous sponsors for this event. This event has been, made successful by the generous support of a number of different parties. First, I want to thank the class of 1970 for their support. In addition, this event has received generous support from the IHSP, Institute of Health and Social Policy, that is, Division of Transcultural Psychiatry, Culture, Mind, and Brain program here at McGill, and of course, my home department, Social Studies of Medicine, as well. I also want to thank Dr. Friesen for doing such an incredible job organizing this event. Really grateful to her. I'm also grateful to the support from Elena Bernier, as well as Heike Farber, who provided a substantial amount of administrative support to pull off this event. So thank you all, and looking forward to the discussion.
Great, thank you so much, Jonathan. Yeah, and thanks as well from me to everyone you listed, as well as Stu and Jonathan for their tech support right now, and also putting together the video. We did a lot in sort of transforming this event that was supposed to take place last March, as I'm sure many of you know. And it was just, I think, the week before that everything shut down here. So we were, tickets were booked, suitcases were packed when the pandemic really hit hard here. So I'm really happy we still get to have this event. I'm a little bit sad it's not in the historic Allen Memorial Institute, but I'm also really happy that we had Andrea Tone's words to still give us a reminder of the significance of that space and the history at McGill. So she's not one of our panelists today, but I want to extend a huge thank you for sharing and contextualizing this conversation, especially for us in the McGill community. So I'm going to start first by introducing Erica Dick, so one of our speakers who is, I'm so excited to have you here as a historian of psychedelics who I've, really admired your work for as long as I've known about it. So Erica Dick is a professor in the Department of History at the University of Saskatchewan. She's a Canada Research Chair in the History of Medicine, a member of the Royal Society of Canada. So you probably remember watching her talk. It was entitled Psychedelics, Renaissance or Flashback. And I think this talk, like her book, Psychedelic Psychiatry, LSD, From Clinic to Campus, offered an incredibly rich account of what psychedelic science looked like in the mid-20th century, particularly in Saskatchewan. And it also made Saskatchewan look incredibly cool. That's something I loved about the book and the talk as well. She's also working on a new book project, which is going to be a collection of essays about the global history of psychedelics. So you should definitely check that out. So I'm going to hand it over to her now to just give a short little summary or update related to our talk.
Thank you so much, Phoebe, for that embarrassingly generous introduction. I am very, very pleased to be here from Treaty 6 territory in the homeland of the Métis. I'm sad that we're not all together in Montreal having this meeting in the Allen Memorial Hospital, but I'm also really pleased by, I look around and flip through, there's so many people who are able to attend who perhaps wouldn't have been able to come to Montreal for this. So I know that it's difficult to get people to Saskatchewan often. So it's really nice to be able to share some of these ideas and to have this really interesting conversation with a diverse group and some familiar faces, or at least names I see on the screen, and lots of new people as well who I haven't met yet. So you've all watched the videos, presumably. I'm not going to belabor what I said already, but I wanted to take my couple of minutes here just to reflect on what being a historian in this moment has come to mean and how it's helped me to appreciate the changing discourse and the changing landscape of psychedelics. And I'm looking here at my co-panelists and having listened to your presentations recently as well. I think Mark and I met over a decade ago. Maybe I shouldn't say how long ago we've known each other, but a long time when actually talking about psychedelics tended to be a smaller gathering. I can't imagine getting 78 people out, or however many people now on the list, out to some of the meetings, we had smaller groups and sometimes more quiet conversations. And I had the good fortune to cross paths with Tess a number of times as well. And our conversations have also, I think, really helped me to appreciate how much this conversation has changed, and quite rapidly over the last few years. And listening to your presentation yesterday also helped to remind me of some of the brilliant work that you're doing that I'm not sure was possible, or you may not have been able to convince your academic committee to support it had you done it, say, 20 years ago, for example. And so as a historian in this moment, I find it very fascinating to have looked back at some of the psychedelic research that was taking place at mid-century and how that intersected with psychiatry and neuroscience. And again, this links in with Andrea's presentation as well, but that sort of really rich moment for a coalescence of a variety of ideas that intersected with changing attitudes towards the ethics of medical experimentation, but also the changing nature of psychiatry, what it was capable of doing, and a kind of buoyant enthusiasm for what might be possible. And I think, and I may be wrong about this, but I think that we're at another phase of reflection in our 21st century landscape, certainly here in North America, but I think this is true elsewhere too, that there is a period of reflection. And some of that is motivated by frustration. We could say a frustration with the psychopharmacological revolution that hasn't necessarily borne the right kinds of success stories. We haven't cured depression. People still suffer from schizophrenia. We see growing numbers of sufferers and growing numbers of disease categories. And so I think there is a kind of moment of reflection, and psychedelics once again emerge as another way to see pain, another way to theorize suffering, and perhaps another way to ethically imagine how we can intersect or interact with human experimentation and medical intervention. And I'm very excited for this conversation, and I haven't been paying attention to my time, so I'm going to stop there because I really want to hear from others, and I'm very excited to be part of this panel. So thank you.
Perfect. Thank you so much. I think, yeah, it's an incredibly interesting moment. And yeah, I'd love to hear all of your perspective on how things have changed as you've been part of this conversation for a while, because I imagine it looks radically different than it did 5 years ago, 10 years ago today. So next I want to introduce Mark Hayden, who I'm also incredibly happy to have here, the Executive Director of MAPS Canada, MAPS being the Multidisciplinary Association for Psychedelic Studies. So I think, you know, he's obviously got a really unique position, is situated in the psychedelic landscape, particularly in Canada, in a really unique way. So we're lucky to have him here and his voice. He's also an adjunct professor at the School of Population and Public Health at the University of British Columbia. He's been involved in thinking about drug policy reform for a very long time. And in his talk, Psychedelics, The Path Forward, he engaged in thinking about psychedelic research, legalization, and policy, and I think did a really phenomenal job giving us a big picture view of what's taking place in this landscape right now. So I'll hand it over to him. I know he's going to give us some exciting updates.
Thank you, Phoebe. It's a pleasure seeing you, Eric. It's right, we go back over the decades. It's wonderful to have history with people. So it seems like we're making history today. Things are changing rapidly. So even in the last few weeks, specifically, you may know, Health Canada has engaged in a public consultation process around the Special Access Program. And I believe that psychedelics will be opened with that vehicle, which is so exciting. So the Special Access Program, as you probably know, is a process by which drugs can be available outside of the prescription process. To access under the Special Access Program, you need to have either severe or life-threatening condition and have tried everything else. Now, and so in my discussion with the Health Canada folks, they've assured me that they won't allow psychedelics or anything else to be available under the Special Access Program if they believe that it would in any way be challenging of a clinical trial. They want clinical trials to be primary. But so in our context, where we are completing our phase 3 clinical trial, Health Canada knows that we won't stop that. So there's absolutely no reason why MDMA-assisted psychotherapy for post-traumatic stress disorder won't have a parallel rollout to our phase 3. And it'll happen relatively quickly. I mean, I'm not exactly sure how long it'll take Health Canada to review the comments. We sent them 60 pages of comments that were 100% favorable. So it is reasonable to believe that they'll open it up after they've done a review. And so I'm discussing with them what conditions people should be accepted. So when people do a special access application for somebody, a client that they're working with who has post-traumatic stress disorder, under what conditions should Health Canada say, yes, you can access MDMA? And just to be clear, it's outside of the research context. So people working in their own private practices and therapeutic processes. So what I'm recommending for people, or for Health Canada to when they look at these applications, is for the applicants to be MAPS trained. And my logic for that is the MAPS training is the best. They've been refining it for decades. And they not only provide training, but they provide supervision. I'm also suggesting that people be master's trained level and above. So either psychology, clinical social work, clinical nursing, psych nursing, or psychiatry are the kind of bullseye professions that I'm recommending. But the big one that I think is of interest is we've had some problems, to be completely blunt. It has not been an easy road. As you know, we brought this process to Canada. And if I look at the challenges we faced, I think one of the solutions would have been if the people were in the context of teams, if they were not alone, if they're within the context of peer support, peer supervision, peer accountability, I think the problems that we would have had would have been less. And so I'm actually going to recommend to Health Canada, they actually look at people in the context that they're providing the work in, and that they actually train whole teams of people to minimize the potential for huge blowback. I mean, I think that there's a huge opportunity here, but there's also a huge risk, because if we do it badly, it is not going to look well on psychedelic legalization. So my recommendation is master's level trained and above, all of the regular special access program, but also mostly with people within the context of a team process. What I have been given by the Americans is they'll train 30 Canadians under sort of my list. I basically asked people across Canada to give their name to me. I put them on a list, and I'm going to get 30 people trained. That will be cohort number 1. Then they will be supervised by the Americans, and then they will get to do training and supervision. And I would like to essentially grow it exponentially. Those 30 or maybe 20 of those 30 then train, 5 or 10 people each, and then that becomes cohort number 2, and that just grows exponentially from there. So we're in actually a process of legalizing psychedelics, which is, quite frankly, incredibly exciting. Thanks, Phoebe.
I agree. It's incredibly exciting. So thank you so much for that update. It's definitely, adds something really significant to the conversation. So next I want to introduce Tassine Noureddini, who I've had the honor of watching speak on several occasions, and I was always wowed. And the same thing happened today, or, when I watched his talk that he submitted for this. So he's a research fellow in anthropology at Durham University in the United Kingdom. The talk he gave was called Containment Matters, the Set and Setting of Psychedelic Research. I think this concept of containment is incredibly fascinating and generative. I thought it's a really useful concept to think through so many of the challenges and questions and barriers that arise in the psychedelic research space. So as you know, he's conducted ethnographic research at Johns Hopkins in psychedelic research for smoking cessation. He's also working on a book project around psychedelics, especially in relation to mental health, which I'm really looking forward to reading, and is currently organizing a conference that's ongoing right now called Psychedelics, Madness and Awakening. So I really encourage you all to check it out. It's a fascinating group of people and speakers, and has been really, really interesting so far. So I'll pass it over to you.
Thanks, Phoebe. It's really kind introductions. I'm not sure mine's so deserved, but thank you. Thanks, everyone. I'm speaking from East London, and I'm British. But I spent a while on the East Coast of the US, which includes where I did some postdoctoral work, which is where I joined a psychedelic research team at Hopkins. Just to clarify, that wasn't ethnographic work. That was doing qualitative interviews for them. But I was trained in kind of ethnographic methodologies before that, during my PhD and before, and resumed that afterwards, which led me on a bit of a journey. And so just to kind of recap in a way that's a kind of a story behind the presentation, but also a review of the presentation, that journey was to learning a little bit more about some underground psychedelic practices and neo-shamanic practices in the kind of East Coast area of the US and elsewhere in the US. And the term container comes up a lot. People use it a lot in quite a kind of relaxed kind of way, or I think in a way that I found to be fairly under-theorized. And so it seemed like a really interesting term to think with, that the usual kind of term for thinking about context in the overground trials is set and setting. But what's interesting about thinking about the container is that there are also these kind of married imperatives to contain psychedelic experiences and, of course, the drugs themselves, which may or may not have been exacerbated by the kind of what happened back in the 50s and 60s before things were shut down. That's something that I'd love to hear from Erica, but anyone about. So I was kind of interested in how the knowledge that we're producing about psychedelics, because they're produced in a certain context and we recognize set and setting to be important, that means that there's a kind of the epistemics, what we know about psychedelics, and the therapeutics of psychedelics, like doing the trials within a kind of therapeutic environment, are very braided together. Those knowledges are very braided. And then when we start thinking about how politically there's an imperative to contain them, economically, if we can contain them, we can find ways to kind of package them up and medicalize them. So it became a kind of a rich term for thinking with. And in the piece, in the talk, it was interesting to think about what containers do, kind of like actual material containers. What do? I mean, they certainly hold things. They also leak and overflow. And that's super interesting in relation to psychedelic experiences, because they are such powerful, and in some ways one could almost define them as excessive experiences in their nature. So what does it mean then to enroll them into kind of medical protocols or but there are other things that we can think about. The ways in which to contain something is to put a wall around it, and to exclude as well as include, and I think that's something that maybe is thought about less or reflected upon less when we talk a lot about interconnection and connectedness. And then I feel a bit funny because I'm kind of reviewing my talk, which neither of the other speakers did, which I think, so it makes, I feel a bit like egocentric in doing that. I guess the last thought was that was just playing with the idea that another thing containers do is they reflect. There's the label on the container might tell you what's within it, but also the kind of the oak of the barrel will put some qualities into the wine, and in relation to psychedelics in particular, as mind manifesting, as a kind of, we can think about the reflective quality of the containers that we build and how they sort of surface certain ways of understanding ourselves, certain kind of mind manifestations. So I try to kind of play with some of that in the talk, and that's a kind of summary of it.
That's perfect. No, that is what I'd asked for. But then, I also said, extend how you want. And Mark had exciting updates. So that was perfect. And I actually think that leads really, really nicely into one of the questions that I wanted to start with for the panel is, I was thinking about this point you made about reflection, Tassine, in your talk. And I think, one thing about psychedelics that's so interesting is how incredibly difficult it is to describe them or pin them down. They take so many different forms. They express themselves in all sorts of ways. When you hear about people's experiences, they're very hard to describe or contain. They just are so incredibly messy. And I think as Erica's historical exegesis made really clear, cultural and social forces can play a huge role in how we end up describing them. So they, have a myriad number of ways we could describe them, and they take all these different forms, but they kind of get squeezed into particular narratives or descriptions at different times. And as we heard, they went from insight to insanity, being, these menaces at the end of the day. And I think that's so fascinating. And so I'm curious if you have thoughts about what are the sort of dominant narratives at play today that have allowed for this enormous resurgence and that are giving shape to legalization and, the processes, the narratives that we are currently holding on to and embracing and putting out there.
Now the awkward thing where we figure out who's going to actually try to answer that.
Right.
Mark, I think you know. Does anyone want to go first?
Happy not to.
Sure.
Sure. You go ahead, Mark.
So our goal is to medicalize psychedelics, and we're doing that absolutely and completely intentionally. So the goal of medicalizing is to engage the medical community, to use the language of medicine to offer a healing process. I mean, you can't do a clinical trial unless you have an indication. So we have to treat something that has a diagnosis. And we're doing that intentionally, partly because that's the vehicle of legalization is stage 1, 2, and 3 clinical trials, but it also is the vehicle of shifting the public dialogue. The recreational use, as Erica can wax eloquent about, has a very different dialogue back in the 60s, but we're bringing the medical language and the medical approach. We're engaging physicians, and we're intending to use that as our vehicle for legalization.
Great. Yeah. So I guess one other question I, think is entangled is which narratives should we be pushing forward? So some are sort of arising and getting a lot of play in the media and the public eye, and others are sort of becoming buried or less visible. And so, Mark, I think you very clearly hope for a medicalization narrative and see the potential in that and the good that it can do. I'll open it up to the others, both, what's happening and what should be happening in terms of these forces.
I'd like to take a crack at this in a slightly different approach. I think there's something really interesting happening that's allowing for these questions to gain some more validity and some more momentum. And it's not that people didn't question, why psychedelics were illegal in 1984 or 87. I choose at random not to coincide with the Canada Health Act, but earlier, and why they seem to be coming before Parliament today. And I don't think it's because the people we're electing are necessarily more pro-psychedelic, but there's something else behind this opening up or this relaxing of attitudes. So partly, I think that there may be other changes afoot. The decriminalization of cannabis, I think, has a lot to do with relaxing attitudes more broadly, not necessarily people who are interested or even knowledgeable about cannabis or psychedelics, but just again, relaxing some of those narratives of fear that we sort of have in our history. But I think there's also, more deeper questions about how much psychopharmacology has become part of our modern living and how our ideas and attitudes towards trusting medications and drugs, and where that category, where the sort of flimsy container, I'll borrow Tassine's word here, where that line is drawn. I think we've seen medically prescribed medications on the street, producing some of the worst addiction crises and suicide crises and overdose crises. And I think there's a deeper questioning about medical authority, political and legal authority, and who's got the upper hand in terms of what is safe and what is not. And that, I think, it also resonates with the 1950s period and beyond. But I think there's a deeper questioning about that. And the last thing I want to say on this in a slightly different direction is I think there's an opportunity here if we attune our narratives or if we pay attention to some of these experiences. There's also an opportunity for a deeper set of reconciliation measures. We are in Canada engaged in a process of reconciliation with Indigenous communities and engaging with a deepening of the relationship, or a deepening of interest in decolonizing narratives and practices. And if we actually pay attention to Indigenous knowledge about plants more broadly, and think about that in the context of ritual, and think about the context of healing in the small h kind of way in a non-medical context, not to take away from the medicalizing of psychedelics, but to borrow valid principles and to really think deeply about Indigenous ways of knowing, I think we actually have a really interesting opportunity to reconcile, how we engage with pain and trauma as a modern society.
Fascinating.
Yeah, I could follow from that. Thank you for that, Erica. Yeah, maybe I'll throw a couple of other things into the mix and add to that a bit. I agree with all of that. There's a kind of a standard story that Nick Langlitz tells in his book Neuropsychedelia, which is about the kind of legitimation of psychedelic science by kind of, in a way, making it psychedelic science. So the kind of latching on to the kind of neuro, especially since, as he points out in his book, the kind of decade of the brain, as it were, the kind of the 90s, that I think that's a kind of, one way of thinking about a kind of proximate cause. Also culturally, kind of talking about how within the West, kind of spirituality is on the rise in different ways, or there's a kind of, I guess in the academy, we talk about a post-secular moment right now. So I think that also kind of allows for a more receptive kind of ground for these discourses around psychedelics that aren't confined to the neuro to appeal. There's a kind of a pull factor in terms of a lack of other kinds of treatments, and that kind of keys into what you were saying, Erica, about a kind of failure in lots of ways, or at least a messiness in terms of how the pharmacological kind of revolution, the long promise of that, has played out. And also the as you said, Erica, the kind of what I would kind of call healing justice movements are very much kind of on the rise and more visible today, and that connects with kind of decolonizing imperatives, interest in ancestry, in spirituality as pertains to one's own life and meaning moving forwards. And so psychedelics really kind of resonate with that. Maybe one other thing I'd add, which I think is really interesting, is that technologically, we have VR, AR, we have these kind of more and more immersive kind of technologies growing at the moment. And I think maybe there hasn't been too much overlap there. I mean, so there are some interesting like neurofeedback people, for example, I know, who are drawing on psychedelic protocols and ways of mapping the brain under the influence of psychedelics to try and gamify them and reproduce them through neurofeedback techniques. But we'll see a growing confluence, I think, at that intersection. So that all prepares the ground too, I think, in a way.
Fascinating. Yeah. Thank you so much, all of you. I think those, provide the...
Can I throw another thought out?
Of course.
So when I started doing presentations on psychedelics about 13 years ago, I had a couple of physicians who would whisper to me in the corridor that they're interested in a hushed voice so that nobody could overhear. And that's grown to a group of about 60 physicians who have reached out to me who said that they're directly interested. And I pulled them together into a group. So an invitation to anybody here, if you happen to be an MD, specifically I'm interested in psychiatrists, but are interested in participating in a discussion with your peers, do let me know, drop me an email. But that group, when I get together with them, what I hear is a huge dissatisfaction, specifically psychiatry, a dissatisfaction with what they're offering right now. And the idea that psychedelics could actually take people off of long-term mental health medications and actually heal people is so exciting to that community. It's the excitement is visceral when we get together and talk about this stuff.
That's, really interesting to hear. There might be this sort of disappointment in the pharmacological revolution, both in the public, but also in practitioners. So I think it makes sense to think of those as two contributing factors. So I wanted to throw out one more question that, is on a similar kind of note. I'm fascinated by cases of treatments, practices that don't sort of fit the mold of evidence-based medicine very well. I do a lot of research around placebo, which is a big challenger, and psychedelics, challenge this mold in so many ways. Blinding is so incredibly difficult. What is a placebo control to match for a treatment? We have all this discussion of, practitioners needing to have their own lived experience before providing. The whole discussion of set and setting, is really different than a lot of what we do in evidence-based medicine. So many of our expectations and the mold is really challenged in this space. And to me, this concept of containment, fits really nicely in kind of how psychedelics push against the container of evidence-based medicine and just don't really allow it to take the form it typically does. So I wondered if any of you have thoughts on this sort of pushing against the container. How can that help us? How can that hinder us in moving forward in this resurgence?
Sure. Yeah. So if we're talking about the container from my perspective, and I said the container is medicine, I do get pushback because there are many people, quite frankly, myself included, who really have a vision of psychedelics beyond just the treatment for specific diagnoses. Like psycho-spiritual explorations is certainly on our agenda. And so if I think about, my crystal ball, my optimistic crystal ball as I gaze into it about how I would like to see this unfold, is we're going to legalize, in fact, we are right now legalizing psychedelics for specific diagnoses, and there are multiple organizations who are doing that. And then it'll be used off-label. So it'll start with PTSD, and then it'll go to trauma, and then it'll go, well, trauma is the root of everything. So then it'll go to addictions because that's trauma and everything. So it'll just grow. The off-label use will grow and grow and grow. And then somewhere, as these hundreds of clinics roll out across Canada, somewhere in there, popular opinion will change enough so people will actually just want to have the experience. Better than well. People who would like to have a spiritual experience will, and that public demand will shift. And then we will have a very different discussion on our hands. And essentially, psychedelics will be legalized, I believe. And the question will become, what is the container then? Because, I've written a guide manual, actually, and it's available on Amazon. It's a psychedelic guide manual, and it's designed to be a cautionary tale. Because certainly having been in this world for a while, I realized that this can go wrong very, very quickly. And we've experienced things going wrong. And so in my manual, I talk about the problems that we're going to face and how to manage that. Because the larger this gets, the more opportunity for problematic situations to arise. So I think as we grow, it'll be good because more and more people will have access to it. But without the container of professionalism and the container of a college that people can complain to and are accountable to, then we'll have a lot of problems. The vulnerability of people under the influence of a psychedelic attracts all kinds of people who really shouldn't be doing the work. Thank you.
Thanks.
Tess, do you want to rock, paper, scissors, or?
I'm tempted actually, but I'm happy to go just to break the order.
Sure.
Yeah, I think pushing against the container. I guess it brings to mind two ways of thinking about how one can approach the challenge of containing, and one might be to try and sort of try and divvy up within the task of containing. Well, what are the different factors in play, and and then how can we control each of those factors, from the pharmacological to the social or whatever, the cultural. And another approach would be to kind of take a bit more seriously the ways in which psychedelics are kind of excessive, and it's kind of in their nature to sort of, in the nature of these experiences, to kind of overflow attempts at kind of trying to constrain or contain what they will do. But so that's just kind of, I don't know if that helps us to kind of think about the question in different ways. But there are in terms of that excess, we see a lot of I mean, I'd like to hear more, Mark, from you about kind of some of the challenges that you've seen of late, or to date. But from what I understand, we've seen a lot of challenges so far, and I'm not sure that professionalization will solve them. But so even with a kind of, in a professional kind of industry, it will be like the challenges we see without psychedelic assists to psychotherapy and healing, and yet it will be all that much more because of the nature of the experiences. So that's maybe a kind of cautionary note.
Yeah, I think I'm going to pick up on that a little bit as well. I think that psychedelics represent a really fascinating intellectual project. And one of the things, even coming back to your earlier question, is that I think there's also a kind of appetite for using psychedelics as a tool for exploring some of the edges, maybe of the container, but for exploring some of the edges or frustrations that have been chafing at us for some time, whether that is in the field of mental health or access to a kind of healing care that allows for elements of spirituality or ritual that we might not see as fitting into a medical container. I'm going to just totally riff on Taysian's work now. But
it's not.
I love the way that psychedelics allow us to ask questions that push into that messiness or create messiness out of otherwise neat systems. But from looking at this issue historically, I think one of the areas that really truly failed is figuring out these big questions about how to, and we can call it regulate, how to normalize, how to mainstream, or how to make safe those psychedelic encounters. And I think it's something that for myself, looking backwards as I normally do, looking back and sort of taking lessons from some of those historical moments, we do see a clash of ways of knowing psychedelics, and we can see that in philosophical terms, we can see it in colonial terms, we can also see it in terms of gender, and we can ricochet this through a whole variety of different ways of understanding power dynamics. There wasn't consensus on whose model was going to work, or where the intersections were going to be between medicine and commerce, or between healthcare. So this was introduced at a time of Canada creating its Medicare program. So there were deep questions about the sort of healthcare economics. We also saw psychedelics being introduced at a dramatic period of change in psychiatry, and mental health services more broadly. So moving away from long stay custodial hospitals into a care in the community, or we could argue not enough care in the community, but a sort of dissemination of people into communities, into different kinds of settings. So the role of the individual in monitoring their own health became even more important in those moments. And so psychedelics sort of fits in and doesn't fit into so many different threads. And I think the same thing is happening today. Of course, I would argue that we'll need 50 more years to be able to tell what's actually happening today, but I think we see a kind of splintering out, but there's also tremendous opportunity in that. There's a tremendous opportunity for alliances, for people who are engaged in an intellectual project about psychedelics who may not necessarily be champions of psychedelics. And I don't think we've mentioned it yet, but the questions around palliative care and the role of psychedelics in palliative care, I see as an incredibly fruitful space for having some of these conversations that remain within a kind of medicalized space, but allow for conversations that push beyond the borders of the medical environment. And, if we were in Montreal, I would give a shout out to Belfour Mount and probably point towards the direction of the hospital that he coined the word palliative in. I don't know where it is in Montreal, to be honest. But it's really interesting to see these intersections of, the birthplace of palliative care, at least the coining of the term was in Montreal, at the same time that Ewan Cameron, as Andrea Tone has explained, was really exploring some of these edges as well. And so I think I like to use those historical intersections to think about where we might push at some of the edges and recognize those alliances that might not be so obvious within the psychedelic world. I don't know if that makes sense.
So interesting. Yeah, absolutely. It makes a ton of sense. And I know, I hope there's some people here who are involved in palliative care and very interested in psychedelics at McGill, because I know there's absolutely enthusiasm here. And I think you're right, that is a potentially very productive space, and also, makes room for other kinds of outcome measures, sort of things to pay attention to, rather than the, symptom reduction that we would look for in the more clearly psychiatric context. So super interesting.
If we're going to push the edge here and talk about potentials for psychedelic in the future, I can't resist. Couples. Different psychedelics offer couples different things at different stages of their relationship. So early couples, allowing them to drop their barriers and really get to know each other, but mature couples who need a spark, psychedelics can offer an enormous amount of bonding and connection and revelation and communication that I think is unparalleled. And I think that's a place that we will go as a society sooner or later, is enhancing and strengthening couples relationships.
Great. Yeah, I mean, I think the potential is really enormous. Go ahead, Tess.
No, just picking up on the kind of time theme, is that I don't know, I'm not sure about, like, one way of configuring this is kind of thinking about what's happening now, what will happen, and then what we hope might happen, down the line. But in terms of kind of thinking about the betterment of well people, right, or couples therapy, I certainly know of couples who use psychedelics for their, in their relationship. So I feel like it's maybe a different way of looking at it, rather than linearly through time, is that it's distributed spatially. Like, these different things are happening. I don't know. So these different things are kind of happening now. And what that means is that it introduces a kind of a politics and maybe even ethical questions about, well, who do we include now? Who do we not include? What do we prioritize? And so on, rather than thinking about it in terms of kind of a monolithic us now, and then we'll hopefully open it up to, for example, off-label and then sort of outside a medical context. That's where there's some friction, I think, which makes things tricky.
Absolutely.
Especially for those people who struggle with the medical system for various reasons. Sorry.
No, I was just agreeing. I think it's, raises a lot of really interesting questions about how, if we do go this medicalization route, how will our sort of recognition of expertise be distributed radically differently than it has been? So of course, these practices have been ongoing the entire time, it's been Schedule H. And there's been tons of recognition of expertise within communities of, who is as a guide, or individuals or couples, while people are participating. And so a lot of these proposals come with new ways of distributing or recognizing who's an expert or has the relevant expertise, experience, who's able to have access, et cetera. So I think it is very politically charged as we think of what this transformation will look like, and very ethically charged as well. So I'm getting lots of great questions. I kind of want to turn it over to some of our audience members, but I also want to, if any of you want to jump in with questions for each other now or anytime throughout, please feel free. But if not, I'll hand it over to Megan Kuber, who's got a question for Mark.
Hi, sorry, I'm just getting my video set up. Hi, Mark. In your presentation, I noticed that you touched on the intersection between schizophrenia and psychedelics. A lot of the clinical trials that I've looked at haven't necessarily included people with either past or current psychotic disorders. And additionally, a lot of them haven't included participants with a family history of psychotic disorders, like schizophrenia. So I'm just curious, given that we're seeing access opening up to psychedelics, do you see the use of psychedelics in these populations moving forward?
That's a huge question, because I would say 95% of all of the literature, both academic and things like trip reports over Erowid, which I've done a deep dive into, where I've searched for the word schizophrenia and psychosis, have basically say the connection between psychedelics and anything to do with psychosis is problematic. It destabilizes people with schizophrenia. And that was very consistent. And I'm sure Erica could talk about the history of that, because it's also a long history of believing that those two are like oil and water and should never be joined. So it was with great interest that I ran into an individual who told me a long story, and I wound up interviewing him many times and publishing. I wrote his story up and put it on our website. You can go and read it. And essentially, he was an individual who has voices. He has schizophrenia, and his voices were originally a huge problem for him because they were judgmental, negative, condemning, and furious with him frequently. And then he found that a large dose of a psychedelic made everything worse, which one would predict, but he found a microdose of either LSD or psilocybin changed the voices and made them positive, loving, constructive, and encouraging him to work hard. And so it was such an interesting story. I decided to write it up. And I've been talking to people about it. And I found one other researcher, quite frankly, who has joined with me in doing a really large survey. So we were actually we just opened the case of the data yesterday. We're about to close it. We have 1,500 respondents. And one of the themes in the survey is looking at major mental health diagnoses. So I haven't done the data analysis yet, but I noticed with Rotem Patanker and Thomas Anderson's microdosing survey, I think there were 12 people. They had about 1,000 respondents. I'm just pulling out numbers here, but approximately 1,000. And I think 12 people within their survey data identified as having major mental health diagnoses and microdosing. And it wasn't clear why, and it wasn't clear what were the major mental health diagnoses. So we wanted to expand on that in our survey and find out, what are your diagnoses? Are you microdosing? Are you macrodosing? Why? Is it changing your symptoms, or is it helping you manage the side effects of the medications you're on? So I just think it's interesting, because I've had a few anecdotal reports now from people currently who are telling me that they have met people or know people who have either schizophrenia or some psychotic disorder and have found psychedelics beneficial. My dig into the literature is I've only actually found one paper, and then Erica actually recommended a book. Thank you, Erica. But the paper was kind of curious. It was published in 1956, and it was in a hospital where they had a social group for people with schizophrenia. And they found that normally the folks would either get together and not talk, or they would get together and talk, but they wouldn't talk in relationship to what anybody else was saying. It wasn't a conversation, it was just a series of monologues. And they gave them a very small dose of LSD. Small is the key word in this sentence. And what they found is the people who were silent normally started to talk, but they had a conversation. They actually talk to each other. And so that's the only research paper that I can find. And then Erica recommended a book for me when I asked her, because I always reach out to Erica if I can't find information, and recommended a book called Into the Mental, which was a woman who had schizophrenia and then wrote a book about her experience that was actually positive with psychedelics. Yeah. So the data is not in yet, but it's certainly a subject of interest.
Did anyone else want to jump in? I know you both thought a lot about this intersection too.
Yeah, can I just say something about that book? The woman who wrote that book, Kay Parley, was a psychiatric nurse, and it's kind of an interesting story. And again, I think there are intersections here with that anecdotal evidence, but also with the subject of this symposium with the ethics. So one of the things she reflects on a little bit, both in the book, but she was also wrote newsletters in the hospital quite frequently, and I've gone through these, where she talks about how she was excluded from those trials because they were worried that something might happen. So she doesn't get represented in the published data. And yet she was a coveted guide, because not only had she had experiences of her own psychosis, but then when she had her LSD inspired psychotic experience, she actually talks about how lovely it was, because she knew it was produced by having taken the drug. She knew it would end. And she said it was the first time that she could actually get comfortable with those voices. She does talk about hearing voices during it, which is interesting also, but she has a very pleasant experience with LSD that she felt helped her to love her psychosis and helped her to feel whole again, feeling that she could love herself entirely. But she talks about how she was discouraged from talking in the public about, or from participating in some of the published materials. So this might be one of those questions that we also think about a different kind of container for which people get selected into the trials. And I think this is a continuing theme that we see in psychedelics as well.
Yeah, I could pick up on that. Yeah, there's a conference going on right now. I'm one of the organizers. It's called Psychedelics, Madness and Awakening: Harm Reduction and Future Visions, and it's right on this kind of topic. We're doing it in an extended way, and talks will come out through till April. And this week, Phoebe Friesen is one of the speakers. But so I recommend checking out that material. That speaking about kind of microdosing, there's in some ways that's super interesting, and gosh, microdosing, like who knows? The science is it's nascent in that on that. But in some ways the microdosing stuff is less exciting, right? In terms of the model, the pharmacological model, the medical model that it sort of would anticipate would be a kind of something more like a kind of chronic use. Whereas the idea with kind of macro doses, again, is that, wow, something radically different can happen in one's experience as a result of taking a psychedelic in the right kind of way, we could say. But coming back to schizophrenia, it's such a dodgy diagnostic category. I mean, I would sort of side with people sort of saying that it's kind of meaningless as a diagnostic category, that it's a family of different symptoms in different places at different times. Different demographics would be way more diagnosed than others. It can so there's a lot of kind of variability there, and I think that the trick when thinking about what we could call psychosis in a kind of more medical vein, or madness is a term that's kind of reclaimed by mad justice movements. The trick is actually really thinking about harm reduction. And it's thinking about certain practices, like a term that comes up a lot in the psychedelic space is groundedness and grounding. And I think that's very important. There's an idea of kind of madness or the schizophrenic as this kind of figure that comes with a lot of kind of caricatures, and one of them is that they're in this kind of constant state, whereas actually kind of if one has a sort of a period of feeling quite unstable, or a period of what kind of psychotic kind of experience, then afterwards one can be very stable for a very long time, and then also very much have a lot of insight into why it is that at certain periods people feel really unspun or ungrounded. None of that is taken into account when you have a lifelong kind of stamp of this kind of this very damaging diagnostic label. So thinking about when one could use psychedelics in the macro range to understand. And then the last thing I'd say on it, I'm sorry, I'm also writing a book on this, so it's like, it's totally, I'm really interested in it. But the last thing was about, I've forgotten. I'm sorry. Anyway, I just want to leave you with kind of harm reduction is probably the most important thing. Yeah, I'm sorry. The last thing is coming back to something, Mark, you said, which is trauma. Trauma is being understood to be really central as a driver behind kind of psychosis and madness. By no means in all cases, and that has its own problematic kind of tendency where people tend to kind of assume there must be trauma and seek the trauma, even in cases where people feel like there is no trauma, and that itself can kind of become a kind of hegemonic or a kind of dominating kind of framework. But in a lot of cases, it's about trauma. And so I think any of us could speak, we could all speak about kind of the relationship between psychedelic experiences and possibilities for healing in relation to trauma. So once you start to unpack that kind of quite demonizing label of schizophrenia and kind of talk about it in terms of like what it actually is in a particular instance, then I think that there's a lot more scope for thinking about the overlap.
Great. Yeah, so fascinating. I think this area is especially ethically charged too. We see this boom in trials taking place and them sort of just mimicking the one that came before with regards to inclusion exclusion criteria. And you've got to wonder what kind of path dependencies are being created and what kinds of access will be limited as a result of these choices that I think often aren't that thoughtful. You know, they're just sort of modeling the standard model that came before, of which there is a handful. So it's a, you know, I think a very ethically charged area. So I'm going to pass it over to Khalil, who's got a question and I know has thought a lot about access to trials. So go for it.
Hey, thanks, Phoebe. Just to introduce myself, I'm Khalil. I'm a master's student in the bioethics unit in the philosophy department. And yeah, my research is also really invested in a lot of these questions about specifically around psychedelic healing spaces and drawing on the tools of critical race theory, phenomenology, and transcultural psychiatry, among others, thinking through how can we decolonize these healing spaces in psychedelic, but more general mental health context, let's say. But I was really inspired by this concept of containment, as Phoebe already said, just an amazing way of framing this discussion, Tessine. But I'm sure the other two will have some comments. But I wanted to ask, so in the kind of concept of containment, there's one sense which I think is maybe the most intuitive for people who are part of the psychedelic community or people who are very familiar, in that there's this kind of, let's say, epistemic or even metaphysical contradiction going on. If you're trying to constrain a psychedelic experience or psychedelic phenomena itself, there's something problematic and even violent about that type of constraint or containment. And then conversely, like thinking through from a, say, bioethical or medical discourse, there's a lot of reasons that we might want certain types of containment, particularly when it comes to things like informed consent. There's, been a lot of documented cases around sexual assault and, patients and doctor power dynamics. People being on psychedelics are obviously going to be very open to particular types of experiences, emotions, et cetera. And so it seems that particular types of containment are ethically warranted or even, should be mandatory in particular cases. And going back to, how Erica is outlining a lot of the historical abuses in the Western colonial uptake of psychedelic substances. So I'm curious where you envision or how you might approach that balance between the kind of unconstrained ideal psychedelic experience that many of us who are invested in psychedelic experiences kind of want, in terms of removing particular types of containments that are very, as I said, constraining, violent, et cetera, while striking a balance in the kind of, let's say, bioethical sense that we want particular types of safety and security and power dynamics to be in check for people to have the types of healing spaces that they can actually benefit the most from.
Thanks, Khalil. Great question.
That's definitely for
wow.
I could say something quickly, but I feel like I've spoken too much for the moment already. But I could say something quickly, and thank you for that. Well, I think you really outline actually one way of thinking about like a predicament, a set of predicaments. Personally, I would say that I don't. It's an open question as to whether we, and that's another question, would want a completely unconstrained experience. In some ways that very much does seem, if it never ends as well, like that is the kind of route to a certain kind of madness. And I don't know. So I wonder if, rather than rather than thinking of containment or the uncontained as good or bad, I'm more interested in thinking about now as a time within which those dialectics of containment, containability, uncontainability, they are very much in the air, and maybe in ways that don't get knitted together so closely. The kind of the thinking about the set and setting as a container doesn't often, I think, get spoken about at the same time as thinking about the imperative to contain the experiences kind of collectively for the medical system, etc. So I think it's nice as a kind of a metaphor, maybe in like a sort of Lakoff and Johnson kind of way, or it's a kind of it feels like it's a kind of evocative term because it crosses those scales and problematics. And so, but yeah, what do you both think?
So I'd like to be quite specific, and I'd like to talk about touch. So, and certainly it's interesting in the manual that I wrote, there is a section, there's a lot of discussion about essentially boundaries. How do you establish boundaries? Because what we're dealing with is a medicine, especially MDMA, when it's used in the context of therapy, it's a bonding agent. It connects people and it has an element to it that's very touchy-feely. So how do you work with a medicine that is a bonding agent where people often welcome touch in the context of therapy? And how do you actually do that? And how do you do it ethically and cleanly? And so my answer to that is lots of discussion. So open discussion as you're setting people up for the experience. You talk about touch and you talk about what non-sexual touch is and how it works. And you set people up for that, and you're explicit about what sexual touch is and what non-sexual touch is. And you have that discussion quite a bit in advance. So people are really set up for the experience of non-sexual touch. And then you have the experience with people where you often do have non-sexual touch, and quite frankly, even hand-holding is very, very common during the psychedelic experience. That's non-sexual touch. And so you have the experience with people where people do have a bonding experience. That's the nature of the medicine, is bonding. And then afterwards, you talk about it, and you talk about, feelings of closeness and feelings of connection, but then you debrief it in a way that is, for want of a better word, professional, and really sets it in the context of healing. So you quite frankly, you don't continue the connection. And one of the problems that we've had has been, the continued connection between the therapist and the subject in our studies, because that bonding, I talk about the importance of bonding, but I talk about the problem of over-bonding, because we've had over-bonding problems. So I think the discussion that we need to have is, what is touch? When is it sexual? When is it non-sexual? When is bonding appropriate? And when is it over-bonding and problematic? And I think those are the discussions we need to have, and we need to have them initially with people as we're setting people up. We need to have these as part of the debriefing for all of our sessions. And when we talk about it explicitly, I think it's incredibly helpful, because when we don't talk about it, those things go wrong.
Great.
Can I say something really quickly? I'll try to be quick. I just want to sort of take a macro step back from the specific encounter, but I think your question is the $64 million question, or upgraded to today's dollar figures. It is a huge question, because we know from the past that sometimes psychedelic experiences inspire or amplify libertarian ideas about the world, for example, or they splinter off into these sort of aggressive political perspectives, ideological perspectives sometimes, and we can see that. And I think for me, where this boils down to is, again, that sort of intellectual, we need to spend some intellectual energy on thinking about access. So if we say we don't want to put a container, we want people to be sort of free to have not only the experience they want, but to be, unfettered in that encounter. Does that mean that, I can fly to the Amazon and I can just walk into a place and take the ayahuasca because I have privilege? It raises a whole variety of questions about the interconnectedness of psychedelic plant medicines as well as synthetics, elitism, access issues, the corporatization and commodification of psychedelics as well. And so I would tackle this from a different perspective, and not to downplay the potential for other kinds of abuses. But I think for me, as we kind of spiral this question up, the crux of it is one of access. And if we are going to make this into something accessible that balances out those concerns for safety and access across a variety of experiences, then I think we have to wrestle with those questions in a more direct way. And that puts us right in line with all sorts of healthcare economics that go well beyond what we are dealing with in terms of psychedelics specifically.
Great. I think that actually leads really nicely into our next question, which has to do with these sort of big structural questions around exclusion. So Rebecca asks, how do we make sure the medical narrative is not perpetuating historical mechanisms of exclusion of marginalized groups that are not contemplated by North American medicine?
Yeah, I can try to have a stab. Yeah, I think this is a really important question. And I think as, you know, here we are in this virtual setting, and I believe that there are people attending here from outside of Montreal. This question and these conversations are in some ways being enriched in this COVID moment as we have the capacity, and maybe it's our first point of call, is that we can actually talk about these issues across a variety of spaces. And it's not just those of us who can afford to fly somewhere or to spend time in some space, but it's been interesting over the last year watching these conversations, as I think there's I think we are seeing a diversity of perspectives. Some of that is coming from questions of environmental stewardship around the plant medicines, as I sort of alluded to. But I think there's other questions about access or the sort of racialization of trauma, or questions about sexual abuse and the gendered power dynamics that continue to exist in, and it's not to say that this is the 1950s where all of the medical graduates were male, at least in the study that I looked at. But you know, things are changing, but there are still power dynamics at play that are continuing, that I think we need to spend some time thinking about as we think about these access issues in the big, broad way. And those questions of power, as Mark just talked about, some of them are really explicit and become sort of hyper in these particular moments. And I think both thinking about it ahead of time, borrowing that sort of harm reduction idea when we think about our approaches to psychedelics, but also thinking about that integration period. So both in a medical setting, but also in a sort of public health setting, how do we integrate psychedelics in a way that actually takes these principles and embeds them in an institutionalized access point?
So, building on Erica's ideas here, I wrote a paper on how I believe psychedelics should be legalized. And I started, it took me years to write the paper, partly because I kept offering ideas to audiences in conferences and getting pushback that I had to struggle with. And my dominant theme was, you know, it should be a profession, it should be, quite frankly, medicalized, or at least professionalized. And people should access the experience within the context where they can complain about the person who provided the service, which means a college and professionalism and training. But all of that equals cost and reduced access. And so the complaint or the feedback I would inevitably get when I would talk about this idea at a conference, I would get somebody standing up at the back and they would say, I disagree. And I would say, tell me more. And then what they would say is, I love psychedelics, and what I do with my partner under the influence of a psychedelic in our bedroom, I do not want supervised. And I had to take that to heart. And so we came up in the paper with two tracks. One track was the professional model. So if you want to pay for the service and get treatment for a diagnosis, or you want to provide the service and you want to be paid for it, that's the professional track, and that should exist absolutely and completely. But there should be a second track. And the second track is essentially, if you would like to purchase a psychedelic for use in private with partners and friends, you should be able to if you have been trained. And I think the minimum training is 2 weekends. So weekend number one is knowledge. You know, what will 100 mics of LSD do to you? What will 600 mics of LSD do to you? You know, how do you set up a container? What is setting, safety, and dosage? What do these words mean? So it's the first weekend is knowledge, and the second weekend is an experience with a trained professional who can take newbies and give them an experience in a context that is reflective of the knowledge that they've learned on the weekend before. And then there needs to be a test, and the test is pretty simple. You know, why would I not take 300 micrograms or 300 milligrams of MDMA? You know, what is 1,000 mics of LSD going to do to me? What is setting, safety, and dosage? What do these things mean? And if you can pass the test, then you should be granted a license to essentially purchase a small amount of psychedelics for use with your friends and your partners. And at that point, we've dealt with the accessibility issue, because really there's no huge overhead costs. And essentially it's people providing the service to each other and having experiences with each other.
Yeah, I could pick up a bit on that. I guess so. One of the big questions becomes whether that second track is not incentivized by if what we're following primarily is the first track, and in ways in which actually the kind of being able to enroll psychedelics into kind of profitable kind of industries will incentivize a kind of preventing the prevention of that kind of second kind of decriminalized or legalized track from ever kind of flourishing. So there's I think there's a kind of a question there that in terms of access, I do think the work that's specific, again, thinking about specific people are doing is really great to highlight. And I always think of Monica Williams's work in relation to this, in terms of enrolling non-white demographics into the psychedelic trials and thinking about race-based trauma and kind of, just thinking about the experiences themselves and the knowledge generation that is occurring around psychedelics as being very limited and narrow. And so looking at how one can open that up and what some of the more structural and historic barriers are to doing that. And then I think of your work as well, Erica, in terms of kind of thinking about history and highlighting the ways in which histories are told are also very narrow and white male elite, for example, and your work in kind of bringing a lot more female voices that have existed within history kind of to the fore. So thinking about kind of diversity, both in terms of telling richer stories of what has been, as well as kind of bringing in more constituencies, in terms of access. And then one other thing I'd say is that it's maybe, as well as thinking about access puts a lot of it on like who can get psychedelic therapy, but we need to really attend also to who it is who's providing psychedelic therapy. And there are certainly attempts to kind of open that up and widen that and so on. But in thinking about some of the perhaps quite intractable problems that will come with psychedelic therapy, so coming back to that example of kind of touch, it's not just a problem of telling customers or patients that kind of informing them that, but in those strong bonding experiences, they're also not devoid of power, and that it's the provider who has a lot more of the power in those. I mean, perhaps you could sort of argue that, but essentially the provider has a lot more of the power, I would say, in those experiences. And so thinking about how they view touch and why they view touch the way they do, perhaps for older generations, seeing touch as itself a radical act, coming out of the 50s and into the 60s and 70s and beyond. The landscape of what touch is in relation to consent has shifted a lot, and I think much of the onus should be on the providers. They're not not just about kind of educating the customer who comes along, which I assume that no one would disagree with, but I just wanted to highlight that.
So we have so many good questions. I'm a little bit sad because we only have 10 minutes left, but so I'll give a quick one that's for Erica about the peyote ceremonies that Osmond and Hoffer started to pay attention to. Just did the participation in this ceremony have any effect on the research that was conducted subsequently?
The quick answer is yes. And if this person is interested, you can also email me for a longer answer if you would like. But I'll just say briefly that Osmond started writing legal affidavits to Canadian Parliament, but also to what was then called the Native Law Group, to try to reopen and challenge the Indian Act. And so that's one of the direct consequences, was it helped him to articulate something that he felt was a cultural right, and that this should be reopened as part of something that was considered sacred, that should be preserved and protected, and that was beneficial. And I'll keep it quick for now.
Great. I mean, that relates in an interesting way to the last question and discussion as well. So we probably have time maybe for one more, being honest, maybe two, we'll see. So Nick King, I know, has a question, so go for it.
Sure, thanks very much. I remember reading a story a few years ago about microdosing in Silicon Valley as a sort of productivity hack. And what really struck me was the experience of psychedelics seemed to be different. This goes back to something that I think you've all talked about, Erica in particular. Do you think that it's possible that if in the future the containment is totally broken, the experience of psychedelics will actually change on a large basis, in the same way that you read the historical accounts of the experience of sugar and caffeine, and it seems very far removed from what we think those experiences are. So I'm wondering about your thoughts, for better and for worse.
I'd just say something quickly in that I think the vocabulary would change. And I think the narratives that we tell will change, partly due to the changing vocabulary, but also different ways of being familiar with experience and different ways of communicating those experiences. If it continues to be the thing that nobody gets or only at Christmas time when the sugar is available, it's this coveted, treasured, protected, maybe like a polished narrative even. And I think if it becomes something that we can converse with, and I can assume that, you know, everyone here has had a psychedelic, I might use slightly different language. And as that changes, I think our vocabulary will change. And so I don't know if that necessarily answers whether the experience will change, but the way that we talk about it and the way that we memorialize these moments or the meaning we give to them, I think will change over time.
I have a simple answer to that question, which is a huge yes. And I look at the narratives, if you actually look at the details of the narratives within different indigenous traditions of how they think about and see psychedelics, it's completely different from Western models. And even Western models have changed over time. So there are many different ways of interpreting the experience. And I think they will continue to change. So yes, and absolutely.
Yeah, I'd agree with that. It's a really great question. And I think it could potentially change really fast. And that's then, you know, an interesting question for thinking about the kind of the future, the kind of the near future of medicalization and psychedelics in general. And I think it's a massive missed opportunity actually on the part of regulators who tend to not really care about the post-approval scene. It's kind of, there's not a lot of knitting these data streams together in order to kind of, I think it's a missed opportunity to better understand, well, what is a hidden expectation effect in this kind of pre-approval stage, that by tracking it with kind of post-approval and down the line, we can actually kind of pull that out and be like, wow, that was the effect of all of the optimism in that earlier decade, which we can now see, you know, like down the line. I think a lot of the data streams as we get post-approval will become proprietary, and that will probably, unless it's forced to kind of be, you know, shared, then that can't happen. So.
Great. So maybe we have time for one more quick question in that case. So we've got one from Alberto who asks a question about the demonization of Timothy Leary in current research. So Leary's become an almost mythical figure in psychedelic research, representing the antithesis of the scientist. Everything contemporary psychedelic researchers should avoid if they want to avoid social backlash again. To what extent can we argue that the blame for the prohibition and the stop in research has been simplistically and excessively attributed to Leary and his drug mysticism? Maybe a question for the historian, but any of you take it.
I mean, I too have heaped blame on Leary in my own work, but I do think it is dangerous to vilify a single person. And I think that perhaps overwhelms some of the other issues that are much more complex, of course. And, you know, I don't think it's appropriate to see one person and pluck him out of the story and say, this time we don't have a Leary and therefore it will be different. I think he came to embody and represent a variety of things that had gone off the rails, but he also was a big champion. And, you know, he's also a complex and dynamic figure. And so I think we need to, I think that our psychedelic movement, if it is, if we want to call it that, requires a diversity of voices and a diversity of egos. And sometimes we need big egos to push that story forward, and Leary was certainly that guy. But we also need to temper that with the people who are going to quietly and safely and ethically, I'm trying to quote Mark here, hold the hands of people who are going through distress and trauma. And sometimes those aren't the same people, but we need a whole variety of perspectives in this movement.
Great. Well, maybe we have time for one more. We're on a roll.
Could I just do a really quick shout out to Danielle Giffort's book, which is kind of about the kind of ghost of Leary and the current resurgence of research, and that came out last summer. Might want to check that.
Thanks. Okay, so last question from Jackie.
Sorry. Okay, you can hear me?
Yeah.
Perfect. I didn't think I was going to get to ask a question. So thank you everyone for all the information. It's been really helpful with looking into psychedelics. I'm just going to go ahead and ask the question. So I'm not a doctor or anything. I'm just very, very intrigued by it, the subject. And I kind of got myself into a situation in 2018 where, after doing a lot of studying up till now, that I did in fact do an acid therapy on myself. And it started with one big epiphany, I'll call it. And then after that, me and my friends microdose, and I ended up closing all the doors with my past, my family, all this stuff, which led me into a spiritual awakening. And it was really hard to accept. And I had to do a lot of inner work with myself for the past 2 years to be like, okay, like right at this moment, they're pairing me with a doctor to diagnose me with bipolar. And the reason why I'm here, and I'm so happy that I can actually ask this question, is like, is there any therapist on the psychedelic side that do open up to normal people such as myself? And I guess I'm looking for a second opinion with this question. Sorry, I try to like condense this as short as I can. So if you want to ask me any particular questions, by all means. But yeah, I was just looking for a second opinion. Yeah.
Jackie, I get asked that question all the time. I would venture that I get asked that most days. So I'll give you the buzzword, and the buzzword is integration therapists. And there is a huge number of them, but exercise caution as you're trying to find that person. There are a lot of them out there, and often they say they do integration after the psychedelic experience. But just be careful, you know, be patient, beware. There's a lot of folks out there. Some are wonderful and some are not.
Definitely. I agree completely with that. And I think already knowing so much about myself and the subject, I'm not going in there blind. And thank you for giving me that word of caution, because I was hoping they're integrational therapists. Like I'm still going to for sure do the bipolar steps, of course, but it kind of scares me, to be honest. Like, I really believe that psychedelics and spirituality coincide so closely together that like my story for them to, you know, I'm just scared that people might be getting misdiagnosed when maybe it's a spiritual awakening happening. And I don't think people really accept spiritual awakenings as a norm at the moment, but it's there and scary in a sense, in a good way. So anyways.
Could I add in that thanks for sharing that. And there is a whole kind of literature around spiritual awakening, and you know, that question of kind of breakdown or breakthrough. So there's that literature, and there are some good organizations that are very, I think, like good at like working with people who have kind of gotten or gotten the first steps into getting a diagnosis, a kind of a mental illness kind of diagnosis, but got questioning that. So there are those organizations, and I'd be happy to send you a couple if you want to email me after this.
I would. Okay,
yeah,
great. Thank you.
Yeah,
that'd be awesome. Thank you.
But I guess the key thing for me, just adding on to Mark's comment, is that it's really important to find an integration therapist or group where you can share a certain kind of, whatever your politics are or your views are around medicalization, around getting diagnosed, around what it means to have bipolar, you might end up finding an integration therapist who's quite well qualified and quite good in some ways, but really kind of, for example, really kind of believes in these diagnoses and you don't, for example. And so making sure you don't have a mismatch there is probably quite important, because you want to be able to kind of move forward together rather than fighting against each other, obviously.
Yeah, exactly. Yeah. And I guess my only concern with going through the traditional system, we'll call it, talking to the doctor at the moment, because I just started to reach out, because after so many years, it's like, okay, I really believe I just developed a sixth sense, and that might be weird to other people, right? Your pineal gland opens up. I totally believe in this. And I understand how it sounds too, for sure. And yeah, that's why you're recommending an integrational therapist. I would love to do that.
Great. So
thank you very much. Yeah.
Perfect. I really appreciate you sharing your experience with us. And, I think it fits really well, in all these topics that we've discussed. And I hope you do find a therapist who really, agrees with you and suits your needs at this point in your life. And I'm looking at the clock. We've unfortunately run out of time.
Okay, no problem.
I'm sorry to everyone who didn't have a chance to ask their question. I see that there's a lot of really good ones in the chat, so apologies. But a huge thank you to everyone who did ask questions. And of course, an enormous thank you to our three speakers for sharing your time. Your lectures were really, really fascinating, and I think had so many interesting intersections, and this discussion has just brought it even further. So just a huge thank you on behalf of the Biomedical Ethics Unit and all of our other sponsors for sharing all your wisdom.
Thanks so much, Phoebe, for organizing this, and for everybody for all of your attention and questions.
Yeah,